Depression is more than simply just having a bad day or feeling unhappy. It's more than just having a few bad hours. All of us can go through periods of feeling down, of not feeling up to it, having difficulty in getting out of bed. But when you're depressed, the persistent low mood can last for weeks or months. It's more than just a few days. Sometimes we are told that it is a trivial matter and not really a genuine health condition. People who think this are wrong. This is a genuine illness with real symptoms. Lives are destroyed because of this. It is not a sign of weakness. It is like any other illness where you really have no choice when you get this. It's not something you can snap out of, it's not something you can pull yourself together. It frequently coexists with other difficulties like anxiety, addiction, uh, relationship problems at home, with your partner, with your children, at work. The good news is that it is possible to treat this like so many different illnesses. It is possible to treat depression and anxiety so that you can feel as well as you did before and achieve the excellence in your life that you deserve. Depression and anxiety can affect people differently. It can present with a variable number and severity of symptoms. This can range from feeling low, lasting feelings of unhappiness, feeling hopeless, thinking things will never get any better. Everything that you were used to be able to enjoy before, you are unable to now. You can start crying, become tearful. There are physical health symptoms as well, where your heart sinks, you feel constantly tired, you don't sleep well, there is no appetite, there is no sex drive, there is decreased in libido, aches and pains, and life just seems not worth it. If you've been having these difficulties for longer than a few days, up to weeks, these are signs of depression. Depression can destroy lives, relationships, families. The severity of these symptoms can vary from mild to moderate to severe. The persistent low feeling in your mood and your spirits at the bottom of a barrel can sometimes make us feel that life is not worth the trouble. Along with depression, we can also face anxiety. Along with depression, we can also feel stress, palpitations, restlessness, panic attacks. Depression and anxiety can coexist. Sometimes there is a trigger factor for depression and anxiety. It can be our past life experiences, it can be life changing events such as bereavement, losing somebody that we love, Even giving a birth can give rise to postnatal depression. Painful, distressing experiences while growing up in somebody who has a genetic predisposition is one of the biggest factors for people who develop depression. This group of people have a higher propensity to develop depression and anxiety. There is no single cause of depression that we can think of. However, we know that there exists genetic predisposition and exposure to stressful, life changing events plays an important role. More recently, because of COVID corona lockdown, a lot of people might have seen life changing things happening to them. The stressful life has been going on for the last 6 months and it doesn't seem to be ending. Losing loved ones leaving home. I have had experience of helping some mothers who were going through what we call as an empty nest syndrome, where kids have grown up and left home for college and university. And the sense of emptiness, the sense of lack of purpose can drive people towards struggling with these difficulties. People can feel low, people can feel anxious after a bout of physical health problem like COVID or any other difficulties. Many of my patients that I serve talk about a downward spiral, a series of events that just doesn't stop and bad things happen one after another. Relationships suffer because of this, and difficult relationships can themselves be the trigger for depression and anxiety. Life can throw a lot of complex situations at us, and some of them just are too much. And low mood, sleep problems, not wanting to engage, not wanting to get out of bed, not wanting to enjoy anything are factors. Research tells us that difficulties while growing up, painful experiences while growing up, play a very important role in the genesis of depression and anxiety. These painful memories from the past lay down a basis on which we tend to perceive our current life. And if our past experiences are painful, stressful, future experiences, when colored with this, also seem difficult and distressing. And our life today now seems burdensome. You might have heard of a concept called personality. Our personality is a collection of the ways that we look at everything in our life. And our personality is based on our past experiences. I'm sure you know people who sometimes tend to look at everything in a negative manner. These people's personality is very negative outlook. And it is so because in the past their experiences are such that things have not worked out for them. Hence they started looking things in a negative manner, not expecting anything to work out, and that's become their personality. What's also true is depression and anxiety is about genetic predisposition. If your parents, your brothers, sisters have these difficulties, there's a possibility that you will have. And finally, alcohol and drugs play a very important role in the genesis of depression and anxiety. Research tells us that alcohol and drugs and depression and anxiety are very closely linked together. People who are depressed, they end up drinking alcohol, and alcohol causes depression and anxiety. The concept of drowning your sorrows in alcohol is full of fallacy because the sorrows are not drowned, they just come back and hit you back on your face. Alcohol and other drugs affect the brain chemistry. It affects the way our messages from one part of neuron are transferred to another, and that can predispose you to depression. Of course, there are other reasons why somebody can get depressed, like head injury, having a childbirth. Depression and anxiety, as I mentioned, can present with continuous low mood, feeling helpless and hopeless, not being able to enjoy things that you enjoyed before, having low self worth, feeling guilt, feeling irritable, losing temper on your children, with your partner, with your husbands, having no motivation, not being able to look at the future, feeling anxious, feeling worried, having no energy, isolating yourself. In some cases, depression is secondary to past grief, past experiences. And it is possible treatments are available to people who have struggled and continue to struggle with this. Today's topic was about helping yourself with depression without medications. One of the first things that helps depression without medication is exercise. Going out as often as you can, even for a small walk, getting some fresh air, meeting some neighbors, saying hello, plays a very important part in getting you well. If possible, you should join a group of people who walk in the evenings so that that adds to social interaction as well. The second bit that helps depression, anxiety a lot is mindfulness. Somehow we live in a society where we are pushed to run and run and run every moment. Mindfulness helps us to look and feel where we are right now. Mindfulness helps us engage with our present. And this is very effective in helping us realize how fortunate we are that our life has a lot to offer us now rather than what has not been. Eye movement desensitization and reprocessing is a strategy used for depression and anxiety, well researched, helpful to people so that their mild problems don't become major problems. Virtual reality trauma resolution is one way to resolve past traumas. For severe problems, it is suggested that you contact a therapist, and strategies like cognitive behavior therapy, which help you change the way you look at difficulties in life, are very effective. CBT or cognitive behavior therapy, it recognizes that the events in your past may have shaped you, but it mostly concentrates on how you can change the way you think, feel, and behave in the present. So, if your challenges are an extension of your past experiences, eye movement desensitization and virtual reality trauma resolution will help. However, in case your challenges have nothing to do with past, then cognitive behavior therapy is one of the effective treatments. There are other kinds of therapy like interpersonal therapy, acceptance and compassionate therapy, rational emotive behavior therapy, each of them being effective to people with challenges. Summarizing, I would like to say that depression and anxiety is an illness that any one of us can suffer. Research tells us that 25% of world's population, that is 1 in 4 people, are suffering with depression and anxiety at any given time. This can become much worse by adding addiction to alcohol or other substances. It can affect our family, our relationships with our children, with our family members. And yes, societal view that this is a matter of embarrassment exists, but it is not correct and true because it is an illness, say, like flu or fever. And like flu and fever, there is a treatment. It is possible for you to get better. For severe illnesses, I would suggest you contact your psychiatrist. However, if the severity of your difficulties is such that you still are able to understand that you do not want it to become bad or worse, then there are treatments. If you feel in the past, while growing up as a child, your experiences have played a role, then there are treatments for that. Eye movement desensitization and reprocessing, and more recently, virtual reality trauma resolution might be able to help. I hope this conversation has been helpful. I'm happy to take any questions, answer any doubts that you have. I will endeavor to post a copy of this conversation for you to see it at your leisure. You can also choose to drop in a question in the comment section, and I will endeavor to talk about that question next Sunday at the same time at 11 a.m. I wish you all the best and stay healthy and have a very good weekend. Bye bye. My name is Pawan Rajpal. I am a consultant psychiatrist. I practice out of Harley Street in London, and this is third of my Facebook lives. Today, I am hoping to talk about depression and how depression can be helped without medications in some cases. I will talk about how depression and anxiety present themselves, and I will talk about what we can do to make